Let's start with the presentations. First, I would like to request Bikram Adhikari from Dhulikhel Hospital, Kathmandu University Hospital, Dhulikhel, Nepal, who is also involved in COVID response project of Dhulikhel Hospital, and he will be presenting with us depression, anxiety, and stress among home isolated COVID-19 patients in Karnali province of Nepal. Bikramji, the platform is all yours. Please proceed.
Respected everyone, first of all, I would like to thank this organizing committee for providing this wonderful opportunity to have poster presentation in this conference. Today, I will be presenting on depression, anxiety, and stress among home isolated COVID-19 patients in Karnali province of Nepal. The mental health issues, one of the major public health issues throughout the world. Mental health issues cost around $1 trillion each year in the global economy. And in context of Nepal, the WHO has estimated the prevalence of anxiety and depression to be 3.2% and 3.6% respectively. And because of the COVID-19 pandemic, the psychiatric disorders, including depressive symptoms, anxiety and stress, they have been exacerbated because of this COVID-19 pandemic. And in context of Nepal, because of not proper availability of the health facilities, people are forced to isolate themselves at their home. And in our community, there is COVID-19 related stigma and fear of transmission that is intensifying the depression, anxiety, and stress. As a result, and there are very few studies that have been conducted in context of Nepal. So we aim to find out the prevalence of depression, anxiety, and stress among home isolated COVID-19 patients, and to find out the factors that are related to depression, anxiety, and stress among home isolated patients, especially from Karnali province of Nepal. And our study was cross-sectional survey, and we used telephone interviews, and we conducted this study from January 2021 to May 2021, and our study population was home isolated COVID-19 patients, and our study area, the Karnali province, and we took ethical approval from NHRC, and we also took approval from Ministry of Social Development, Karnali province. And talking about our variables, dependent variables included depression, anxiety, and stress, and they were assessed using the DASH21 scale, depression, anxiety, and stress scale 21. And the independent variables we took were socio-demographic variables, and next is a comorbid condition, smoking status, and presence or the absence of the COVID-19 symptoms. They were the independent variables that we took. And for the participant recruitment, we had a coordination with the Ministry of Social Development from Karnali province, and we took the list of the COVID-19 patients under home isolation from MOST Karnali province, and we actively call all the patients whose lists were available through our resource team, and those who meet our eligibility criteria, they were enrolled, and there were a total of 402 participants in our study. And the inclusion criteria included those who were under home isolation and those from Karnali province, and with the age of more than 18 years, they were included in our study. And the exclusion criteria were those who do not give consent and those who do not respond to our survey, they were excluded from this study. And for the statistical analysis, we use R programming software, and we use Clopper-Pearson and Goodman method for calculating the confidence interval around the binomial or multinomial variables proportion. And we use multivariate and univariate logistic regression to identify the independent factors that are associated with the depression, anxiety, and stress. And talking about result, the prevalence of depression, anxiety, and stress, they were found to be 8% depression, 11.2% anxiety, and stress to be 4%. And mild depression was 2.5%, and mild stress, it was 1.2%. Extremely severe depression was 0.7%, and anxiety, extremely severe anxiety was 2.7%, and stress was 0.5%. And talking about the factors that are associated with depression, anxiety, and stress, the depression was found to be significantly associated with the presence of comorbidities, and those who were with COVID symptoms, they were more likely to have depression, and the anxiety was significantly associated with family type, the presence of comorbidity, and the presence of different symptoms, and stress was associated with presence of symptoms and age. Now, finally, coming to the conclusion, we found that the prevalence of depression, anxiety, and stress was pretty large in the study population, and COVID-19 symptoms that has been found significantly associated with the presence of symptoms, and timely counseling to high-risk home isolated patients like those with comorbidities and those with COVID-19 symptoms might help to reduce the burden of mental illness in this global pandemic. So finally, we would like to thank all our team members who worked for this project, and I would like to acknowledge Bill Gates and Melinda Gates Foundation who support our project through which we are able to conduct this study. I would like to thank all those study participants and who directly and indirectly support us in this resource. Thank you.